Hi, I'm Dr. Walter Crooks, and I'm here to talk to you today about what makes us unique here at Life Changing Care and Neurology Center. First off, I'm a chiropractic clinical neurologist. Just like in medicine, we have subspecialties in chiropractic. Mine is neurology, so I focus on the nervous system, the central nervous system, brain and spinal cord, and the peripheral nervous system. Now, what makes us unique here is that we look at you in three different ways. The first way we look at you is structurally. We want to see how your structure is. We want to make sure that the structure of your body is appropriate and optimal. First, we want to look at your spine. The spine should be straight when you look at it from the front. And when you look at it from the side, it should have three curves in it. It should have a lordotic curve, a curve to the front. It should have a kyphotic curve, a curve to the back. It goes backwards. And then we have a curve back to the front again, which is lordotic again. The middle one, the back curve, the upper back curve is called kyphotic. We want to make sure that all that is correct because that gives us a window into how brain function is. If the spine is not aligned right, it can put pressure on nerves that go out to your hands, feet. It can cause you problems with your viscera, with your sexual function, with a lot of things. The next way we want to look at you, we want to look at you neurologically. We want to see how the neurological portion of your body is working, the brain, spinal cord, nerves. We want to make sure that all that is functioning optimally. If you have pain, overall aching and numbness, tingling in your hands and feet, we want to see why that's happening. The third way we're going to look at you, we're going to look at you metabolically. We're going to test you and make sure that all your blood work is done right. We do a 59-panel blood exam here to test for 59 different blood wellness markers. Now, I know you go to your doctor or whoever, and they say that your blood normal, your blood numbers are normal. Well, let me tell you how they do those ranges in those labs. It's just a bell curve analysis. What they do is they take the people that go to that particular lab, they take out the really high numbers, they take out the really low numbers, and what's left in the middle, they call normal. But that's not normal for what we want. We want optimal. What we use here in my clinic is functional ranges. And functional ranges are based on what would be optimal for a human. They're very, very narrow. We want to make sure that you fit in those because we want you to be optimal. Now, another thing that we do when we test for your metabolic system is we test for food-protein reactions. You see, if you're having reactions to food proteins, it could cause you to have immune system reactions. And anytime you have an immune system reaction, think inflammation. Your body has to become inflamed to be able to fight off what it's trying to fight. And if it's mistakenly trying to fight off some food protein, maybe like gluten, well, the next thing you know, your brain gets inflamed, spinal cord gets inflamed. And if this gets really out of hand, and it goes on for long enough, you can become autoimmune and end up with an autoimmune condition. So we want to check that food protein because it's very important. The third thing we want to check for when we're looking at you metabolically, we want to see how your blood sugar is. Blood sugar is so important to the body. I mean, you just look at all these diabetic people that are out there. Blood sugar optimal should be between 85 and 99. We want to make sure you fall within that range. Going along with that, we want to check your hemoglobin A1c. Hemoglobin A1c should be between below 5.9. And that's a marker for blood sugar and a marker for inflammation in the body. And we want to make sure those markers are not out of range because if your glucose goes up and down, up and down, up and down, it causes the blood, the nerves in your body to become unstable. And when they become unstable, they can die. And you can start getting all kinds of symptoms because of that. So you see, we want to check for all this because we want to make sure that you have the best chance at being the most human that you can be. You shouldn't be sitting there right now watching TV or watching me on this video being in pain. That's not normal. You should be able to go walk to the store. You should be able to go walk out to your mailbox. You should be able to sit down and enjoy dinner without having to get up because you ache or because you hurt or because your arms go to sleep. Because you can't feel your feet, you can't walk so well, you get dizzy, you fall over. We want to find out what's causing all this for you. You see, we leave no stone unturned. We look at these three things. We look at you structurally, neurologically, and metabolically to determine what is wrong with you. Look, my name is Dr. Walter Crooks. If you have any of these problems that we were talking about, or anything that people don't really know what to do with you, if you have chronic health problems that the doctor just says, well, you have to learn to live with it, why don't you give us a call? Why don't you fill out the form that's on this website so you can get further information about what we do here? Remember, optimal function equals optimal health. I've enjoyed speaking to you for these last few minutes. Thank you for your time.